Hello and welcome. I'm Jennifer Cardellini, Director for Consumer Information at Benjamin Rose Institute on Aging. Thank you for joining us for today's webinar, News from Washington, Budget Proposals and Their Impact on Older Adults and Caregivers. Today's webinar will discuss developments in Washington, D.C. regarding the Biden administration's 2022 budget proposal for Older Americans Act programs, block grants, and other aging programs and services. In addition, we will highlight areas of impact for older adults and their family and friend caregivers nationally and statewide. This webinar will be recorded. We will be sharing the link with all of you in an email in the next week. Please feel free to share that with colleagues who could not join us today. We have a lot of information to cover in the next hour, so we will hold questions until after all panelists have presented. However, you may submit a question at any time using the control panel on the right-hand side of your screen. Now I'd like to introduce our speakers. Our first speaker today is Bob Blancato, President of Moss Blancato & Associates. In that capacity, he also serves as the National Coordinator of the Bipartisan 3,000-member Elder Justice Coalition, the Executive Director of the National Association of Nutrition and Aging Services Programs, and National Coordinator of the Defeat Malnutrition Today Coalition. Our second presenter is Meredith Ponder-Whitmire, Vice President of Moss Blancato & Associates. She is the Policy and Advocacy Director for the National Association of Nutrition and Aging Services Programs and the Federal Policy and Media Coordinator of the Elder Justice Coalition. She also directs policy for Defeat Malnutrition Today. Last but certainly not least, our final speaker today is Orion Bell, President and CEO of Benjamin Rose Institute on Aging. He joined Benjamin Rose in 2019 with more than 30 years of leadership experience in not-for-profit management. Prior to joining Benjamin Rose, he served as President and Chief Executive Officer at Sequoia Aging and In-Home Solutions, the largest of Indiana's 16 area agencies on aging. I will now turn it over to Bob Blancato.
Thank you very much, Jen. And we are very pleased to participate in another webinar with Benjamin Rose Institute on Aging, focusing on current events in Washington. I want to thank Orion for the chance to do this again, and Jen, all your help, and Sarah as well. Our last webinar was late January. Is that on the first slide?
Yeah.
Can we go to the first slide? And even though we do a written report every month, the last webinar was January, and since that last webinar, a lot has happened. We have turned the corner on the pandemic with increased vaccinations and fewer new cases, fewer hospitalizations and deaths, and a slow and steady return to normal. And Congress has passed what appears to be the last COVID relief bill, which we'll talk about a little later. The economy is also beginning a slow and steady recovery, but we have two ongoing concerns: inflation and worker shortages. The President and Congress are moving on to major new initiatives that we're going to cover. But we wanted to start with an interesting new report that's come out since the time we did our last webinar. So next slide. This is the profile of older Americans that's put out each year by the Administration for Community Living. And some of the numbers that we found most interesting, in 2019, those 65 and over totaled 54 million, or 16% of our population, 6 million more women, of course, than men. But a larger percentage of older men than women were married. According to the survey, 70% to 48%. Probably the most startling statistic we found of all of them was the percentage of older adults who have completed high school. Only 28% had in 1970, we're up to 89% in 2020. Then, of course, the more current statistic about during COVID, between March and April, the unemployment rate for people 65 and over more than quadrupled. Next slide. In your numbers in your state, as of 2019, your population of 65 and over was over 2 million, just over 17.5% of your state population, a 27.3% increase since 2009. That's quite significant. You're one of only 7 states with more than 2 million older adults, and your percentage of people 65 and over living below the poverty level is 8.3%, which is about the average for the country. Next slide. So what's happened since January? Well, let's start with the headline story first of the passage of the American Rescue Plan. That was the 4th COVID relief bill, the first under President Biden, and most likely the last one we will see. It's a total package of $1.9 trillion. You know, I wrote a piece for Next Avenue, and I called it one of the most age-friendly laws we have seen passed in years. Among the big ticket items that we remember, it included the $1,400 stimulus checks for millions of Americans, $1.4 billion for the Older Americans Act, including $750 million for the nutrition program, which brings its total funding provided through the 4 emergency bills to $1.6 billion. And I want to mention that for a second, because as most of you know, in the aging services world, that program went through its biggest conversion in its 50-year history. Okay, it went from a program where more than twice the number of older adults were in congregate settings before the pandemic to a program that was almost 100% home delivered in the delivery of the food. And you know, that cost extra funding, needed extra funding. It cost, food costs have risen in cost. Gas prices have gone up 49% in the past year, and more. You know, what we say is somebody in an area where maybe 100 people came to a senior center or a congregate site to get a meal, suddenly there were 100 different stops that had to be made by providers, and those extra costs were borne in gas costs and so on. So Congress recognized this and provided this $1.6 billion over the 4 bills, almost twice the amount of its normal appropriation. Also within the American Rescue Plan was $460 million in Title IIIB of the Older Americans Act to help the aging network do what it wanted to do from the very beginning, help in the vaccine effort. Next slide. Also in this package, there's $25 billion in health equity, which is a priority of this new administration, including $7 billion for community health centers, $200 million for better infection control in nursing homes, which, as you followed the drama of nursing home situation in the pandemic, a lot of the spread of COVID could have been alleviated had there been better infection control in these nursing homes. The bill provides subsidized health insurance for all who lost their employer-based health insurance, no matter what their age. The bill also subsidized 100% of COBRA premiums through the end of September for workers of all ages who lose their job. These are really kitchen table kind of relief efforts in this bill. $86 billion to pay pension benefits to over 1 million union workers and retirees from either underfunded or insolvent retirement plans, which was something that people really lobbied for a great deal. The had an increased federal match under Medicaid with an additional $12 billion for home and community-based services, and the extension of the special pandemic unemployment checks through Labor Day of this year, the $300 a week checks. This is all in the American Rescue Plan. And next slide, there is also in this package $21 billion for emergency rental assistance, again, for people of all ages, $10 billion for the Small Business Credit Initiative Program, which is helping older adults continue to open businesses around the country. That was a trend that was starting before the pandemic, and it's continuing, but this money is necessary for them to make that leap into that business world. $276 million in elder justice funding. You know, and Benjamin Rose has a major role in the work of elder justice in Washington with the Elder Justice Coalition. This is a significant infusion of money to help Adult Protective Services and the Long-Term Care Ombudsman Program address the issues of elder abuse, neglect, and exploitation. Now, I would point out, and this will become relevant later in the presentation, this bill was passed only by Democrats using what they call the reconciliation process, which only requires 51 votes versus the normal 60 votes to get a bill passed. So this is all about the American Rescue Plan. And we'll go to the next slide, and we talk about what's next, okay? And again, to the extent that anybody can be a clairvoyant in this world, we try, but we know that something will be happening around something called the American Jobs Plan, or what is better known as the infrastructure bill. This was proposed by the president in March. It's a total package at that point of $2 trillion in nature. Let's go to the next slide, and let's talk about the original elements of the president's jobs plan. It called for significant funding in 4 areas of what we call physical infrastructure: roads, bridges, transits, and broadband. Finally has made the list of required infrastructure investments. And then the president also called for a key investment in what's called human infrastructure, which is $400 billion for home and community-based care services under Medicaid. Then the next slide will tell you a current development. The dynamics on this whole thing changed a lot late last week, and maybe if we sit here long enough, there'll be a new development while we're here. But for the moment, this is current. The president, with a bipartisan group of senators led by your Senator Portman, announced an agreement on a revised version of the American Jobs Plan. The new agreement will feature now $1.2 trillion in spending, considerably less than we've started. It will focus on traditional infrastructure, as mentioned before, and then how you pay for this bill includes something which all Americans should be rallying for, which is crackdowns on tax fraud. Okay, the number of people who don't pay any tax at all, who have a lot of money, is appalling. A report came out, many of you saw, about these multi-billionaires who got away without paying any taxes. That's a significant amount of money that we lose each year in this country. So cracking down on tax fraud by giving more money to the Internal Revenue Service is one of the pay-fors. Any money that was not spent in these emergency funding bills of the past could be repurposed for this bill as well. And then there'll be some toll credits and some public-private partnerships to help in the pay-fors. So next slide. So this deal was announced like Thursday or Friday. That same day, the thing ran into trouble. The president, to the surprise of his staff and pretty much everybody else, decided that he was going to say, well, you know, we're happy about this agreement, but don't think I'm going to sign this bill unless it comes along with a larger budget reconciliation bill that needs to get passed. Well, that took about less than a day before he had to walk back on that statement to keep his bipartisan agreement alive. And now we're back to the point where we think the bipartisan infrastructure bill could be passed by late July or early August by the Congress. And what we're waiting for, and in our world, this is the most important thing, the actual legislative language. You got to see what's behind all these agreements and this, you know, these principles and so on. You got to see the real language. And let's not forget, to gain passage of a bipartisan bill, you must have all your Democrats on board and at least 10 Republicans to meet that 60-vote threshold. And that is not guaranteed. The next slide talks about the other proposal that the president came out with, the American Families Plan. Now, this has several main features, including expanded paid medical and family leave, 2 years of free community college and greater college subsidies, significant education and child care funding, and making permanent the child tax credits that were adopted in a bill last year. Now, with this new agreement, that $400 billion I spoke about earlier for home and community-based care that was in the jobs plan or the infrastructure bill will now shift over to the Families Plan / budget reconciliation bill. And then, just to make it even more confusing, let's go to what reconciliation issue is. Next slide. So the budget reconciliation is the second bill. You know, when the president said, I won't sign the bill unless this other bill comes along with it, this is the other bill. This is the big mama, okay? This bill could be as high as $6 trillion, or it could be as little as $1 trillion. But, you know, it's the bill, basically the best way to explain it, it's the bill that those who didn't get what they want in the infrastructure bill will try to get into this bill, okay? And that's where you'll see the price tag go up and up and up. Okay, issues like climate change. You've got a group, very dedicated group in the House and the Senate that want to see climate change adopted as part of a budget reconciliation bill. The president's home and community-based funding proposal. You know, this is going to be very interesting to see because this is a huge opportunity that we've not seen in the years I've worked up here. $400 billion to help enhance the workforce in home and community-based care, to help reduce or eliminate waiting lists in home and community-based care under Medicaid. You know, he has to demonstrate his absolute commitment to that for it to stay. Okay, there's support for it in Congress, don't get me wrong, but the president has to lead on this one. This is his idea, he's got to bring it home. And there'll be several more things probably attached to this bill. Let's talk about Medicare briefly for a second. It's conceivable that in this bill, there could be an effort to expand Medicare by lowering the eligibility age to perhaps 60, and also adding a dental and vision benefit to Medicare for the first time. But at the same time, they want to find a way to lower prescription drug costs. that could also find its way into this bill. We don't know really what is all going to be in this bill, but we know that we'll have a lot of late nights here in our office and other places around DC in the months of July, and even the always look forward to August recess that every member of Congress lives for may go out the window this year because of this budget reconciliation bill. And remember, to succeed under reconciliation, that means all Democrats have to support the bill. It's 50-50 with the vice president breaking the tie. So we look forward to more formal language on this bigger bill coming forward, and we'll share what we learn as the process goes forward. But it's going to be a very exciting time to see how this plays out in the end. And it is now my pleasure to turn the program over to my colleague, Meredith Ponder-Whitmire.
Thanks so much, Bob. If we go to the next slide, okay, we're here. I want to talk about the Biden budget for fiscal year 2022. His budget proposal was released pretty late this year. It's supposed to be released in February, but did not get released until May 28th. And it was very good for many aging programs. So we will go to the next slide in a minute, and I will talk about the various programs. But I would note that it's still pending. It's just a proposal at this point. So it's great, it has great numbers, but Congress always changes those numbers. Even when the House and Senate are held by the same party as the White House, it always changes. The process is now going to move to Congress to complete before September 30th. The House, their goal is to complete markups and floor votes before the August recess. So we know that the Labor HHS Appropriations Subcommittee in the House is going to be marking up their bill July 12th, and then the full committee will be considering the bill on July 15th. So that's coming very soon. We're very excited. And generally speaking, we don't see funding levels that the House is proposing or that the Senate's proposing until about 24 hours before each markup. So I can't tell you what's going to be in the House numbers yet, but very excited to see what they decide to do. Then the Senate is not going to start their process until after the House finishes theirs. And since the August recess or August recess, depending, will not, that's maybe happening, hopefully happening. The Senate's probably not going to start its work until September. So, this could be quite the process. Next slide. I want to point out some of the highlights. The president, has proposed a lot of increases for the Older Americans Act, increases in 3B, very significant increases in nutrition as well, preventive health a little bit, family caregiver support a lot, and then CSEP, the Community Service Employment Program, unfortunately would be held level. I would say on that one that's better than previous administrations. The last few years, we've seen budget proposals that would entirely eliminate CSEP. So, as awful as this sounds, it's kind of a victory. Then it would double funding for Title VI for Native American nutrition and supportive services, significantly increase the Native American caregiver program. The long-term care ombudsman would get the greatest increase it's seen in a long time under this budget proposal. And then small increases for the elder rights support activities, including the APS grants and the other, the data collection grants, et cetera, known as the Elder Justice Initiative within within the Administration for Community Living in Health and Human Services. And I would note that this doesn't include all of the funding increases that Bob was talking about in the American Rescue Plan Act. So APS, for example, received money that is to be put toward fiscal year 22 in that act. It totals out to about $188 million, which is huge for those programs, as all of you know. and that will be split between APS and Ombudsman. We're not sure what the breakdown will be yet, but on the next slide, we can talk about what is next. As I said, the Senate's not even considering their stuff until September. So it's very, very likely that Congress is not going to finish its work on funding by the end of this fiscal year in the end of September. So that means that a short-term bill, a continuing resolution, needs to pass to keep the government running from October 1st until whenever they complete their work. But a continuing resolution means that programs would be held at the same funding levels that they have now. In some cases, that might be good if programs would otherwise see decreases. In some cases, that's not as great because those programs would be slated for increases. But these bills are going to have to find support to pass. So even though the House, Senate, and White House are all held by Democrats, it's not it's not exactly going to end up being like the giant wish list of the president, et cetera, because as Bob was talking about with the Senate, it's going to need 60 votes to pass. So, it's going to have to be a bipartisan bill, meaning we're probably not going to get everything we're hoping for, but hopefully we come close. On the next slide, I also want to talk about an added complication to all of this stuff, raising the debt ceiling, the borrowing limit, which the debt ceiling, we hit the ceiling July 31st. And we're allowed to, as a country, the Treasury is allowed to take some extraordinary measures, but there's no telling, those chances are that only floats us for another couple months at most. So it's really, kind of frightening. We're getting back on our feet. We really shouldn't default. So the debt ceiling really needs to be raised, but it's going to come with a price. The debt ceiling, again, it's something else that has to be raised and, under bipartisan measures. And, there's that usually gets coupled with, other proposals, and, there is no telling what happens and when. And it's, it's very tough for Democrats right now because, they're being accused of spending too much money, and, so that's part of the political price that might be paid. Next slide. So something that we are all tired of hearing about, but is coming back, the election, voting. So we're only midway through 2021, as all of you know. But the election for next November has already started, basically. And, we're already talking about the 2024 presidential election, which, again, it's kind of like, really? We're already there? But, that is coming up in discourse as well. Next year's election is seen as really close across the board for control of the House and the Senate. Because, currently we have the 50-50 split in the Senate, and in the House, the Democrats have, I believe, a 4-seat majority at this point, which is teeny tiny. And, the Democratic caucus is really broad. So that has been a little problematic for the speaker on some of these issues. Police reform, voting rights, climate change, immigration. It's very hard to bring together a big tent party on some of these issues. And these are very, very hot button issues. So, the chances of bipartisan agreement are also not great. But, these are all issues that we elected people to do something about. And so it'll be very interesting to see if anything is done about any of them. Next slide. So there are other issues happening beyond the budget and beyond reconciliation, et cetera. And a lot of that is in the health space. As Bob was saying, the Biden priority, the big one is equity. But also, the administration is really interested in health outcomes and scalability. So meaning that, value-based care, that buzzword, is definitely still in. And there's a lot of big picture work in healthcare, that some of that involves COVID, like the remaining vaccine issues, who is not getting vaccinated, why they're not getting vaccinated, will we need boosters this fall, what about the variants? And then of course there's flu and pneumonia, which last year we avoided the twindemic of flu and COVID, but this year with loosening of restrictions and social distancing and masks could be a worry again. And we're going to have to study, who's been impacted by the pandemic and why. And that's something that the administration is very interested in looking into. Next slide. So, the HCBS thing that Bob was talking about, it could drop. We're very concerned about, whether or not that makes it into the final budget reconciliation. But the real question is, how far does the president really stay with that, as Bob was saying, and within it, what are the priorities? So, are we working on reducing waiting lists? Are we looking at increasing reimbursement rates, or stabilizing the workforce? So that's a big healthcare issue that we're dealing with right now. Next slide. So there are also focus areas in Medicare. Bob was talking about Medicare expansion and some about lowering prescription drug costs, but there's also the trustees report and what picture that's going to paint about Medicare solvency. And a lot of this is going to see some action. The trustees report will definitely happen. The others might. Next slide. So lowering prescription drug prices, how far and how do we do it? The main bill is HR 3. That includes the controversial Medicare price negotiation. Very, on the Hill right now, that's a hot issue. Do we negotiate for the price of Medicare covered drugs? HR 3 was estimated by the Congressional Budget Office to save $450 billion. But, as I said, it's very controversial, it's very partisan, and it's something that would be tough to pass, particularly through the Senate. There are some alternatives. Senators Wyden and Grassley last Congress had put together a compromise bill that unfortunately didn't go anywhere. And Senator Wyden is talking about bringing that back up. There is one new dynamic that could impact this. The new Alzheimer's prescription drug and its expected cost, both to individuals and to Medicare. And there's a lot of concern that it's going to drive up Medicare expenses. So TBD on what happens there, but it should be interesting. Next slide. So life in the post-pandemic world, before it's in front of us, it's around the corner. What are we going back to? What are we keeping? As Bob was saying, really the key test is going to be in the nutrition program, we think. With the conversion, with how many older adults were in congregate, and how programs are starting to reopen. So that's very exciting that this is happening, but it's going to be really interesting to see what innovations are kept. Next slide. So, with regard to nutrition, a lot of money has been pumped into the program, and the increase in flexibilities. For example, the broadening the definition of who is considered homebound has led to big increases in demand. We have a lot of questions. How long does the money stay? How long do the flexibilities stay? Because some of those are dependent on, for example, having a public health emergency in effect or having a FEMA major disaster declaration in effect. So those are subject to change. Will the new clients that are being served remain in the program? How do we avoid the cliff? And those last two questions, are really important ones to ask in the context of the budget and appropriations, bringing it full circle, because, as all of you have seen, without increases in funding, there's no way these programs can continue to serve new clients. There's no way that we, avoid a service cliff where, people are going to have to leave the program because there's not funding. So, having the president propose these big increases, having advocates work for these big increases is going to be key to making sure that the program thrives even with, all the new clients. Next slide. So there's also been a lot of renewed interest in and urgency about social isolation, especially as a consequence of COVID, and then social determinants of health. Those determinants really contribute to who precisely was a victim of COVID. And, we really think that there needs to be a lot of coordination on the social isolation front. We need to inventory what is addressing it. For example, Older Americans Act programs doing a great job. And then, possibly consider it being a health emergency. It's been causing a lot of issues for people across, age groups and across the lifespan. So something to consider. Next slide. So, on social determinants, we really need to invest in data collection here to understand some of the extent of these issues, which would require some kind of, hopefully public and definitely private investment in data collection. And part of that, there is some work going on in the private sector to address that, that I could spend an entire webinar on, but I won't. So just, we need to have some more private sector involvement, but we really need greater federal support. So, that again, circling back to the budget, hopefully, a lot of the programs that do address, determinants from the prevention side and from the intervention side get funding. Next slide. So it's a busy time, to say the least. The pandemic has been terrible. The vaccines have been fantastic, and their impact has been felt as we reopen. The economy is roaring back. There's a little concern that it's roaring back too quickly, but most people seem to think it's going to stabilize. And it's a really exciting time. So next slide. Hang on, because it's going to continue to be a wild ride. So with that, thank you so much. And I turn this over to Orion.
Thanks, Meredith. So I want to take a few minutes and just talk a little bit about some of the impacts of some things in Ohio. So if we go to the next slide. And then, so as we've mostly concentrated around budget issues on the national level today, as the federal government talks about the next round of budgeting, the states, for the most part, are wrapping up their budget proposals for their next fiscal years. And so, Ohio is no exception to that. And just, in fact, on the 28th, there was a bipartisan agreement for a new 2-year budget in the state of Ohio. It's significant in a couple of regards. One, it's a bipartisan bill. It had broad support from both parties in both houses. And aside from some individual areas where they may be subject to the governor's veto, it largely emerged, with broad support from both houses and both parties in the state of Ohio. And you can see in the discussions around the state budget the impact and the anticipated impact of some of the funding at the federal level. So, as in most states, a lot of the discussion in the state of Ohio around some infrastructure issues or around state unemployment or some other areas, the federal funding that's already been committed in the prior COVID relief bills was used to either fill some holes or plug some gaps in some of the funding mechanisms. So, for example, today Ohio announced that one of the things that's in the bill was that repayment of some of the deficit in the unemployment insurance at the state level, using some of the federal money that was available to do that. But the emphasis in the state primarily has been on using the federal dollars for those one-time investments, not to use them for ongoing operating expenses or new obligations, but trying to connect those to activity that's seen as sort of a one and done kind of an opportunity there. Connected in this too is there's a tax cut and a 3% across the board income tax cut in the state of Ohio that it was seen by many as a way to make the state more competitive with other states in terms of attracting business and business environment. And there was also a new school funding bill that soaked up a lot of the conversation about the budget in the state of Ohio. And Ohio, as a number of states, has had its previous funding formulas for public education deemed unconstitutional because they have not demonstrated equitable distribution of financial support across school districts, which leads to serious haves and have-nots. This is something that's plagued publicly funded education in states all over the country, and Ohio is no different. But it is a significant part of the discussion of the budget in a particular year. So those are just sort of broad spans of the state budget. Now, if we go on to the next slide, there are some good things in the state budget. So we've got 3 slides here real quickly, and the first one's about some good things, some bad things that didn't happen, and some things that didn't happen that we would have liked to have seen. So we'll start with some of the good things. Ohio increased by $10 million its funding for adult day programs. And this was something that was advocated for by the Aging Services Network. Adult day programs are a very cost-effective and key component of successful home and community-based service programs as alternatives for long-term care, because adult day is a key part of offering respite for family caregivers, which is essential for people to have the choice to effectively remain at home with long-term care services. There also was some increased commitment to some nursing home reforms, things that had begun, but in this budget there was some additional funding or other language in the bill that strengthened some of this. There was a deliberate focus on increasing the Quality Incentive Payment Program, the QIP program, as a way that as future payments for skilled nursing care, institutional settings will be driven more by quality and quality outcomes for people in the care as opposed to cost reimbursement model for those. And we see that as a good thing, that incentives that encourage better care and that address the costs of care, of providing care, such as the labor cost, staffing ratios, and those kind of things that have a definite impact on the quality of care are addressed somewhat in this bill. There also was some expansion of the authority of the State Director of Health in terms of their ability to intervene with health and safety with residents in institutional settings. So as the state continues to grapple, as all states do, with the sort of the balance of community-based care versus institutional care and about the quality of care in all those settings, this is another indicator that there's a commitment to addressing care and health and safety of the residents in those settings. So some good things in the bill there. Go on to the next slide. And a couple of other good things in the mix. There was an increase in the reimbursement rates for both for non-skilled services such as attendant care, as well as for skilled care and therapeutic care in the home and community-based service side. So there's provision for quality payments on the institutional setting side, and there's also an increase in funding for Medicaid waiver home care services that are funded through the state funds. There also was a new line item of $250 million in the state for expanding broadband infrastructure. And this is another area that broadband became an aging issue over the last year and a half with the pandemic. The realization that broadband is an infrastructure issue, that access to everything from healthcare services to accessing benefits, to employment, to even doing things like shopping online and those kind of things that we did more of or saw the need to do more of during the pandemic, and saw there were gaps in the availability to do that in Ohio. And this was true not only in rural settings, but in lower income urban settings, and in areas where older infrastructure, where that just wasn't allowed for when the things were put in place. And also that tended to affect older adults because they tend to live in those areas where the infrastructure is a little older. And so this, even though it's not specifically an aging services thing, I think it's a good benefit and a realization that remote access and broadband and internet-based service, web-based services are an important part of effective service delivery and infrastructure in the state. So I'm going to the next slide. And so this one, there were some bad things we avoided, things that were in the bill that got a lot of heat and a lot of attention, but did not find their way into the final versions of the bills. And one of these was new testing and eligibility requirements for SNAP benefits. And this is always a concern for nutrition service program providers for a couple of reasons. One, there's very little evidence of any kind that there's much fraud or waste and abuse in SNAP. It pretty much does what it says it does, and it has both an economic benefit for the commercial grocers that accept a SNAP benefit as a form of payment. It's a way to ensure that there are fewer food deserts because there's more opportunity for people to shop for groceries in their neighborhood when SNAP is in play. But the other concern about this is that some of the hardest hit people when these regulations go in are older adults. That when you introduce a requirement that you shop in person, it means that a frail senior who qualifies for SNAP but isn't physically able to go to the grocery store can't have someone proxy shop on their behalf. So if you take in your elderly grandmother who qualified for SNAP, you couldn't buy her groceries for her if you put some of those kind of requirements in place. In Ohio's case this time around, it was about asset testing and some of the determinations about other eligibility requirements were sometimes just the paperwork that's required, the documentation that's expected. Sometimes it's the most difficult population for that are people living with a disability and older, frail adults who are not the target, not the intended target of the attempted reform, but they're the collateral damage when these kinds of proposals go in. And this was in the bill and it came out in the reconciliation process, and we were pleased to see that. Another one that came out in Ohio, and this comes up in other states, is about the tax valuation of affordable housing properties. And the concern here for organizations that provide supported housing is that if you taxed an affordable housing property at the same rate as a luxury unit in the same area, you had the effect of driving up the cost of operating the affordable housing unit and potentially even forcing those things out of communities. And so one of the values of having an affordable housing is it allows people, as they grow older, to be able to remain in a community they've been part of for their entire life. And so the changes in tax valuation could have had a chilling impact on nonprofit organizations like Benjamin Rose and other providers that operate affordable housing as part of their mix of services for older adults. And we were pleased to see that one went by the wayside as well. We're willing to pay property taxes as they are due on properties, but we should not have an inflated scheme on what those properties are worth if they are in fact below market rent properties. So going to the next one. And so we talked about some good things, some bad things that we didn't see, and then some of the things we didn't get. And in Ohio, one of the things that we were looking at was there was an inclusion in the budget for an expansion of PACE programs in the state, and that was taken out of the budget bill. Benjamin Rose does not operate PACE programs today. We were part of the founding of the programs in Ohio. We see them as an important part of an effective community-based option. There is commitment to expand the programs, a willingness to discuss it, but it did not find its way in as a piece of the budget bill. So we'll keep an eye on that one. And we had also hoped for a restoration of some state funding for programs for older adults. That over the last 20 years, Ohio has seen a reduction in its percent of the federal funding that comes to the state for aging programs, because those federal funding formulas are based on population, and as Ohio's population relative to other parts of the country is less than it was 30 years ago, we've seen a reduction in those funding, even though we're one of those states with over 2 million older adult residents, as Bob mentioned at the beginning. So we had sought a restoration of about $10 million in funding for that, and that did not happen in the mix in the current budget either. That was one of the casualties of that income tax reduction, is that the arguments were being made by the advocates that, you've got a budget surplus, maybe this is an opportunity to restore some funding for these programs, and it didn't happen that way. But all in all, not a bad year overall for aging services programs, and some encouragement. There was some bipartisan support for things that we feel really strongly about, and some dovetailing of some things that happened in conversations at the state level with both the federal bills that have already passed and the anticipated impact of infrastructure bills and other things to come. So we're hopeful in the coming year that we'll continue to be able to have some meaningful conversation about effective programs that support the health and independence and dignity of the population of older adults and their caregivers here in Ohio. And we think as Ohio goes, so goes the country. We're sort of a microcosm of the whole nation. The debates we have here in this state mirror those that happen pretty much anywhere else you go in the U.S. So with that, I'm going to turn the panel back over to Jenny Cardellini, who is going to lead us through some Q&A. So Jenny, back to you.
Thank you so much, Orion, and thank you, Meredith and Bob, for your great presentations. We do have some questions from the audience. So Bob, the first one is for you. Could you elaborate on the services that are supported by the Funds for Human Infrastructure?
Right. Okay. And thank you for picking up the distinction between the physical and the human infrastructure, which is a new terminology here in Washington. So the president's proposal for $400 billion is just now reaching its way toward being introduced as a bill. And Senator Casey is leading an effort in developing, trying to get the president's $400 billion done. The two primary areas in this will be, there's a waiting list now that's probably close to 800,000 people seeking home and community-based services under Medicaid. Part of that is because, rebalancing, which is a term that was used a lot of years ago about Medicaid, rebalancing meaning shifting more money away from institutional care to home and community-based care. That began to happen 3 or 4 years ago, to the point where for the first time, Medicaid was spending more on home and community-based care than institutional care. Well, once that started, that led to a great amount of interest on the part of people to get those services, to become eligible for those services. And you add Medicaid expansion to that came through the Affordable Care Act, and now you've got a point where, you've got more demand than you have availability. And so reducing the waiting list is certainly part of it, but having an adequate workforce, adequate both in terms of numbers and adequate in terms of being paid, being recognized for the important work that they do, is very important. This proposal will also address caregiving issues, hopefully including a meaningful tax credit for family caregivers, and also an expansion of the existing National Family Caregiver Support Program, which currently remains the only federal program out there to help family caregivers. So there are a number of things, and then once the bill finally reaches the point of being introduced and considered, there'll be additional features in it, and we'll share that in probably the next Washington monthly report about what's in the legislation to deal with the President's American Families Plan.
Thank you very much. Meredith, the next question is for you. Why does the government seem so reluctant to fund the Senior Community Service Employment Program?
Ooh, that's a good question. Just personal opinion, I think part of it is that they don't understand what the program does. That sounds ridiculous to all of us, but it's something, it's hard to measure, and it's hard to measure the value of a program in people's lives. Because, this CSEP is kind of the little engine who could, as far as, being a valuable opportunity for a lot of people. But, it's kind of hard to measure value by the standards that the Department of Labor sets, like finding sustainable employment off the program, or, just there's a lot of metrics that make more sense for youth programs than they do for older adult programs. So Bob, do you have anything else to say?
Oh, I have a lot to say.
I'm sure you do.
I have a lot to say. So, I mean, Mara's right about the first part of the sort of perception, but we've got to realize that this is the only dedicated program for older workers in this country. Okay, and let's look at this for a second. If we're focused on equity, which this administration is, this is a program that provides people 55 years and over who are low-income older adults with community service employment opportunities. Okay, and so obviously the people that are being served are the people that you're trying to address by improving equity in federal programs. So this should be a time when we are investing more in this program for what it does and what it represents in the context of the equity proposition that we're trying to go forward with. The other thing that gets lost in the shuffle sometimes is that a lot of the programs in the Older Americans Act that we talked about earlier, particularly the nutrition program, would suffer tremendously without CSEP, because CSEP people work in those programs. They provide work and services for other older adults. So, I think, there's sort of an image problem that needs to be addressed. I think a lot of times when you have programs like CSEP, you need to tell the story employee by employee, okay? Because they're going to tell you the story the best. They're going to tell you what they're able to do every day. I just talked to this group earlier today that had some CSEP folks in it. And, they've been out working hard in the community even during the pandemic. So let's hope this situation can be reversed, and we'll do our part to advocate for that.
I want to jump in on that too, since we all did. I think another thing that happens with things like the community employment program is that it's not a big obvious thing at one time. You hear similar kinds of challenges when people talk about social service block grants, because they're built into them. They're very flexible. They're designed to be used in a lot of small settings, different kind of things. And that very sort of flexibility that makes them useful as a community-based program makes them hard to see at the national level, because you don't have a big building infrastructure or 10,000 people in one place. It's as Bob said, it's one person here and one person here. So it is, at least in part, a messaging problem, and how to explain the effectiveness of something that is by its design very individual and helping specific people who need work find their way back into the workforce.
Good point.
Thank you all for commenting on that. The next question is again for you, Meredith. You mentioned that the president wants to lower the age of Medicare eligibility. What do you think the big picture implications of doing this will be on healthcare?
Well, assuming this happens, and that's a big assumption, given the controversy over any healthcare bill. But if this does happen, I think that there's a lot of benefit to this. You have a lot of older adults who might, especially now, who are in that like young old bracket, who might be out of work. Insurance on the marketplace under the Affordable Care Act, it's still age-based. So if you're 60, you're paying a lot higher premium than someone who is 25. And so, having that, that cost reduction there, would help. It would probably take down premiums for a lot of people, because you're removing, older folks who are more likely to have chronic conditions from the insurance risk pool. So honestly, it's a benefit for, a huge slice of the age span. It's just getting the political will to do it.
And I'm going to add something to that too, because even though it says Meredith Whitmire on the screen, it's really Bob again. you know, there's real possibility that the age could get lowered to 60. We're not going to have Medicare for all. That was a slogan more than it was a reality. However, you know, there's a case being built for lowering to 60 for part of the reasons that Meredith talked about the difficulty of those individuals getting coverage now, getting insurance. But you're also dealing with a Medicare program that's changed dramatically since boomers started turning 60 and 65. There are more preventative benefits now in Medicare in the past 10 years than there were in Medicare's previous 40 years. And if you're investing more in prevention, then you're ultimately lowering the cost of the Medicare program going forward. And the other thing to keep in mind is that if we're talking about equity, again, this is an administration that is focused on equity. The life expectancy rate of older people of color is less than white older Americans is. And that should be an argument to allow them the opportunity to participate in the Medicare program at an earlier, younger age. And I hope that argument can be brought into the conversation, because I think it's real. And I think in that budget reconciliation bill I spoke about earlier, that's where it's going to likely show up if there are going to be changes to Medicare. The three things that we talked about that Medicare could face. Okay, one is lowering the age. The other is adding a dental and vision benefit, again, in the context of prevention. And then thirdly, of course, is lowering the price of prescription drugs by having Medicare negotiate for drug prices, okay? The third one of those is the most controversial. It has been for years and has not changed in that regard. The other two, it's hard to say. It all depends on how big they're going to allow that budget reconciliation package to get. You know, it's kind of like putting cargo on a boat. Okay, there's only so much you can put on before the thing starts to sink and can't go anywhere. But you know, that's the job of advocates. Advocates have to make sure that they get their piece in there by making the strongest possible case. And I think those seeking to do the Medicare lowering age have a really strong leg to stand on right now.
Thank you both. Maureen, would you like to add something to that?
Just, the question was also about how it affects the healthcare. I think, there's the potential that if you broaden the pool of participants in Medicare, it also, you're bringing a younger, relatively healthier population into the overall Medicare pool. So, the devil's all in the details, and you'd have to figure out how you had a mix of working people and retired people in Medicare, and you have, but there are a variety of upsides of a larger pool of people participating in Medicare, if we ever can get to the point of having a conversation about how that would impact healthcare and the consumer. We've all in this space, we've all dealt with older adults who weren't quite old enough or weren't quite sick enough to retire or qualify for disability or go on Medicare. And those can be some pretty challenging situations for people in their early 60s. And so it's something that at least deserves consideration.
Thank you. Maureen, the final question is for you. What are potential implications for changes in school funding mechanisms in Ohio for older adults on fixed incomes?
Well, part of the challenge with the state funding formula is it's always been dependent on property taxes as a primary tool. And in our case, we know we work with a lot of older adults that when they're on a fixed income and after retirement, that the property tax, the valuation of their home becomes a challenge for some people to be able to remain in the community as they grow older. We have some older folks, if their home's been paid for a while, their property tax bill may be approaching what their house payment was when they bought the house. So a change in the funding formula that moves away from a dependence on property taxes potentially has some benefit for a low-income homeowner if less of the tax burden is carried on the property tax side. Again, this is one of those where the devil's in the details. How do you arrive at the mechanism for that? The Ohio plan assumes greater state responsibility and a greater emphasis on the wealth of the community where the school is, and an attempt to balance that as part of the calculation, so that lower income areas are not left with a smaller pool to fund their educational programs. But potentially taking some of the focus off of property taxes would be beneficial to a low-income homeowner.
Thank you very much. And thank you again to all three of our presenters and to all of you for joining us for today's program. In the chat, you will find a link for a webinar evaluation that we hope you will complete for us. Your feedback is very important to us as it really helps us to improve our programming. This will also be shared with you in an email soon. We hope you will plan to join us for future webinars that we plan to hold throughout the year, and the ones you see on your screen are our upcoming programs. Information can be found about all of our Benjamin Rose webinars and events at www.benrose.org. Thank you again, and we hope you have a great rest of your day.
Thank you.
Thank you.
Bye.